COVID-19 dashboard number 1078, dated the 3rd of May 2022. And then I'll provide some information on the status of the hospitals in the parallel healthcare system. So I'll start with a summary of the COVID-19 dashboard number 1078, dated the 3rd of May 2022. An additional 347 cases were confirmed positive yesterday, taking the total number of active cases to 8,637. Yesterday's increase in cases takes the 7-day rolling average to 483, and we have noticed an overall upward trend in the number of confirmed cases from the middle of April to present. In terms of the vaccination update, the Honourable Minister will provide further details on the uptake of the COVID-19 vaccine in our population, but we still are at 50.8% in total uptake, and unfortunately 5 additional deaths were recorded due to COVID-19 at 4 p.m. yesterday. We would like to express our sincere condolences to the relatives and the families of the deceased. I'd like to now provide some information on the parallel healthcare system, and this information is as of 7 a.m. this morning, the 5th of May 2022. This morning, the hospital occupancy, or the overall occupancy of the parallel healthcare system, is at 24%. There are 194 patients in the hospitals in the parallel healthcare system. There are no patients in the step-down facilities. And I'd just like to bring some context to these statistics. The hospital occupancy was noted to decrease very slowly at first, and then we went down to about, we were at highest on December 23rd, 2021. And we saw an initially slow decline and then a more consistent decline in hospital occupancy up until last week, Tuesday, which was April 26th. And from April 26th to present, we have now noticed an occupancy that has been slowly increasing upwards. So just for context, we went from approximately 83-84% hospital occupancy on December 23rd, 2021, which was the peak, and up until last week, we were just in the vicinity of about 20%. We have increased from 20 to 24% over the last 8 days. And of course, this is in coherence and is in alignment with the increase in the rolling average that we would have noticed over the same period. There's usually a 14-day to a 21-day gap between the start of the increase in cases and when we start seeing the increase in occupancy at the hospitals. With respect to the step-down facilities, there are 0 patients, and this is a trend that we have noted from the first week in March, and that really implies and shows that the patients that are being admitted into the hospital are very ill. If we were to look at our ICU occupancies, another cause for concern, the ICU level occupancy has been on average 20 to 25% for the last 2 months. That is a good sign, and this morning there are 9 ICU level patients in the hospitals in the parallel healthcare facilities out of a total of 80 available beds, and none in the accident and emergency departments. When we look at the actual hospitals in the system, all are under the benchmark of 75%, again demonstrating that the hospitals are not as filled as they were previously in the last surge. The accident and emergency departments continue to register low numbers of confirmed COVID-19 positive cases. This morning there are 7 patients across 10 accident and emergency departments. The ambulance system is currently at about 12% being used for the COVID-19 patients. Again, a slight increase noted over the last week when we were under 10%, but still low numbers. Ladies and gentlemen, we have noticed trends for approximately 75 days in which our hospitals have been under 40% occupancy. We have noticed low numbers of persons seeking care at the accident and emergency department, and the ambulance usage, another factor that we look at, is also low. However, we need to remember that 82% of those patients who are hospitalized are not fully vaccinated. Yes, there's a lot of uncertainty about COVID-19 and its impact, even 26 months after we started. But there are three certainties that I'd like to remind everyone as I close today. Firstly, vaccination is a proven and effective method to reduce the risk of you acquiring, transmitting, and developing the severe complications of COVID-19. Please ensure that you take up on the offer for vaccination and receive your booster when required. Secondly, seeking early care if you have comorbidities and symptoms of COVID-19, or if you're in that vulnerable age group and population, is key to saving your life. And thirdly, the three public health measures, the 3 W's, work. These are proven methods that continue to prevent persons from spreading and acquiring COVID-19. So as I close, I again thank you for your support continuously over the last 26 months. And let's continue to wash our hands, wear our masks, and watch our distance. Thank you.
Thank you very much, Dr. Richards, for the update and, of course, for reinforcing the 3 W's. We welcome back Dr. Joanne Paul, who is with us this morning to provide a status update on children with COVID-19 and to inform us of other illnesses that are being seen in children in Trinidad and Tobago and abroad. Dr. Paul.
Thank you very much, Honorable Minister, Dr. Miriam Abdul-Richards, Mr. Al Alexander, members of the media, ladies and gentlemen. Thank you for having me again to discuss with you guys about updates with regards to children at this present time, pandemic going into endemic. So next slide, please. We'll start this slide presentation if we can. Next one, please. Wonderful. Thank you. So in terms of the start, we have with regards to the COVID updates. So we've really been having, as Dr. Richard just went through, really reduced numbers, but we've seen an upsurge now. So in terms of the Miss-C numbers, we've had 2 since the last update in February of this year. So we had 76 then and only 2 Miss-C cases. So that's pretty low. In terms of the numbers, we had about 22 persons admitted to Couva Hospital in March, and we had 27 so far in April in terms of children. And if we look at the trends, though, since February this year, it's been mainly incidental COVID for all the children. So we've seen since February, all the admissions to hospital have been incidental COVID. What that means, though, is that they will present with something else, some other medical illness. So, for instance, if I'm a sickle cell disease with a painful crisis, I'll have that. And secondarily, I'll be infected with COVID. But my primary thing is still the sickle cell with the painful crisis. The COVID in children has been incidental, mild, or asymptomatic. So with Omicron, it's been 100% so far incidental. We have had admissions to hospital, but it has not been primarily about COVID Omicron. It's been about the other medical illnesses that they have had. Of course, we've had COVID associated. So we may have, they might present with maybe seizures as COVID associated, but it's not been primarily secondary to COVID. And that's been the trend so far since February this year. Next slide, please. All right, in terms of what we're seeing with Omicron, I think most parents have been seeing this with the pattern, but it's just for us to appreciate it also. It's been 2 by 2 by 2. So we've seen where once they've been infected with Omicron, they'll have approximately 2 days of fever. They'll have runny nose. In fact, they say that the runny nose is almost like a tap running. It's continuous. They're congested. They have sore throat, and that lasts for about 2 days. And then they have 2 days where they're fairly settled. They seemingly are okay. they settle in less runny nose and less fever. And then we have the GI or gastrointestinal symptoms where they'll have diarrhea, they'll have cramping abdominal pain, some nausea, some loss of appetite. So the entire thing might last for about 5 to 6 days, and it's usually 2 by 2 by 2. So in terms of what you're looking for, you'll appreciate that and you know what is coming. So once they start settling down, prepare for the expected diarrhea that's coming afterwards. Next slide, please. Of course, after this 2 by 2 by 2, they're usually fully recovered and it's usually self-limiting. In terms of parents being prepared, I really want to reinforce the parents now. We've had pre-COVID, you were pretty confident about your ability to take care of your child. I want the same to start back now, to be confident. But you have had all the information over the past few months. You've had it from various sources, from the Ministry of Health, and I want you to take that information and be prepared. Set yourself up. You know what to do. You know when to contact your medical person, your medical peeps, and you know when to go to the hospital. You don't have to be panicked about anything. Get your information and have your kit ready. So I usually recommend having the COVID kit at home. It can be a space in your medicine cabinet or a space in your counter away from your children, but make sure you're prepared. So have your kit having paracetamol, ibuprofen is really important for the sore throat. Also have it where you have salbutamol inhaler. Oftentimes with Omicron, it may cause wheezing in some children according to what's happening. So if you've had a child who has wheezed before, definitely have your salbutamol inhaler with your aero chamber or spacer just to make sure you're very prepared. Also, you're expecting some of the diarrhea, so look out for having your G-Sol, your Pedialyte, your watered down Gatorade, and have access to your watered down coconut water. So don't have them have diarrhea and not be prepared by that. Make sure you have it there in your kit. Also, vitamin C, probiotic when they're having the diarrhea with Omicron has really been helpful. I would recommend the small baby dose, not the large dose with adults. So you have your probiotic, your vitamin C, your rehydrating agents, your paracetamol, your salbutamol, and of course, just remember that if you've been having diarrhea, if your child is young enough, less than 2 years old, or they're still breastfeeding, the best thing is breast milk, the best thing for diarrhea. So forget about everything else, just offer that breast milk and you have that child getting better in no time with all that wonderful antibodies. And of course, with regards to the runny nose, make sure you have your saline nose drops. Have an availability of the humidifier or the vaporizer, and also have some sort of thing where you can steam just to clear them up from their congestion. So have your kit available because you've gotten the information, you know what to expect, and you can be more prepared. Next slide, please. In terms of what's happening, though, aside from COVID, we've been seeing definitely an increase, as we expected, in terms of the viral illnesses. And we've had our kids coming out, we've had the adults coming out, and you've been finding lots more COVID and non-COVID viruses passing around, rhinoviruses, other types of viruses, and they've been causing fever. But the main thing is that most of these viruses cause fever for about 2 to 3 days. The key thing about fever, once it happens, don't be panicked about it. You know what to do. But also your cutoff periods. If you've been having fever for about more than 4 to 5 days, then you know that it mostly is bacterial. So you know, okay, 4 to 5 days, bacteria or dengue, that's my limit, that's my threshold. If you've had fever and something else, the child is drowsy and lethargic or irritable, you know it's fever and something. But if it's just fever and your child is totally well, you know what to do, and you know you could observe and monitor and watch that period for about 4 to 5 days. So above 4 to 5 days, absolute 5 days, you know that is something happening there. Have them checked out, and if it's something else and fever, have them checked out. Otherwise, you can manage your pyrexia. Okay, so you've been having that. Next slide, please. What I've been seeing also is a lot more of, again, viruses. It's caused by Coxsackie, and it's hand, foot, and mouth disease. And this is usually where you have ulcers in the hand and the foot and the mouth. and it's usually self-limiting. Very rarely they can have some minor complications with regards to other organs in your body, but usually it's self-limiting. It's usually passed on. If there's a child in the school, you might have it passed on to the other children. So make sure if you see this, keep your child at home with hand, foot, and mouth disease. But it's usually, as I said, self-limiting. The other one we've been seeing a lot more of, next slide, is also chicken pox. That's been coming through. So I've spoken to, usually before these conferences, I make sure we get as much updated information beforehand. So I usually liaise with the private pediatricians and the public ones, and the main increases has been increased viral illnesses, hand, foot, and mouth, and chicken pox. So again, you can see the signs. Most of you, if you're not sure what chicken pox looks like, ask your grandparents, they will know. And you can see what's happening there with that slide. You can check out pictures and you can tell it's chicken pox. If it's chicken pox, keep your child at home. Do not think it's chicken pox and say, you know what, let me sneak my child in to any space whatsoever. Chicken pox is highly contagious. The other thing we've found is fever fits, increase in fever fits or fever convulsions or febrile convulsions. What they've found is that it's not at the height of the fever, notice, it's just when the fever goes a little blip, it sort of short circuits the brain and you have a fit with it. And usually they find the viruses also makes a threshold for having the fever lower. So with these viruses and fever, we've been having an increase in febrile convulsions. And again, we had mentioned this previously in other news conferences, and I'm here to pick up the trends and show you what to do. And we have Dr. Paula Robertson, who is one of our specialists with regards to pediatric emergency and neurology and epilepsy and seizures. And Dr. Rabia Haidar, just going through a quick video showing you exactly what to do if you've had a child with a febrile convulsion. Next slide, please, and start of the video.
What do I do if someone is having a seizure?
Good question. The thing that we want to remember is to stay calm and to remember the key points of your first aid. So this comes from Epilepsy Action in the UK, and the main points that they want us to remember is called action. So I say we've got a person and they're in the phase where they're shaking and jerking. What we want to do first of all is assess the situation, make sure there's no sharp edges, no hot surfaces around where they can injure themselves. Also loosen any tight clothing. So I'm just going to loosen his jacket a little bit. C stands for cushioning the head. So a rolled up pillow, towel, or blanket like I have here. You definitely want to put that under the person's head or neck while they are in the seizure to make sure that they're not going to injure themselves during the shaking phase. T means to check the time. So you want to check your watch, your clock, radio, TV, advertisement if you haven't got those, just to get an idea of how long the seizure is going on for, because it can feel a lot longer than it is in actuality. Some patients also carry a medical alert bracelet or a necklace. So if you don't know the person, I means you just check to see that there's no identification to say that they're epileptic or, for example, diabetic. All refers to the fact that once the shaking phase is over, we want to turn the person over onto their left-hand side. So you can help me Dr. Heidel. What we want to do basically is to turn the person onto the left side. We want to bend this leg that's on top at the knee, right? And I'm going to bend the arm that's on top and stick the hand under the person's chin. So they'll look like this with the head in the neutral position. So this really is known as the recovery position, and in this position a few things are going to happen. The patient's tongue is going to fall forward naturally, any saliva or secretions will drain out, and they'll be able to breathe a little bit easier as well, okay? Right, so we're going to just put him back for a second, just as we talk about N. So N stands for never. So you never want to restrain the person. You don't need to put anything like a finger, spoon, fork, nutmeg, salt, or sugar in the person's mouth. In fact, you cannot choke on your tongue when you're having a seizure, but what happens is that you lose control of the airway temporarily. And so turning the person on this side, as we have just demonstrated, actually allows gravity to keep that airway safe, because that tongue moves forward, any secretions or saliva drain out. You may find that while the person is actively seizing, that their tongue muscles, their jaw muscles are all tightly clenched, and you can actually get injured. You may get bitten in the process or even knock out teeth. So it's much safer to, in fact, have the person on the side. You would take this young person to hospital. or call an ambulance if the seizure goes on for more than 5 minutes, if there's more than one seizure in 24 hours, if the person injures themselves during the seizure, if the person isn't recovering as they normally would afterwards, and there may be a period, as we said, where the person has what's called a post-seizure or post-ictal event where they actually seem to go really relaxed. That recovery period may go on sometimes for a few hours, but if it is going on longer than that and they're not recovering in the way that you know them to, that's definitely a sign to take the person to hospital. Or if you're worried, if they are definitely, this is the first time you've seen it, or you're concerned, that for sure would be a reason to go to hospital. Okay?
Thank you for that. We'll continue with the slides if we can after the video. The next slide. Okay, so while we start up the slide presentation, we want to talk about the new hepatitis. So we try to make sure again that we get all the new updated information from all the sources, WHO especially, and liaising with all our contacts in the various countries. And the mystery hepatitis we've been hearing about in children, and you're just seeing pictures now with the yellowing, the jaundice of the eyes. So usually hepatitis is inflammation of the liver, and the signs they can present with includes jaundice, pale stools. They may be, because the liver is on your right upper abdomen, so they might have the area there swollen, so they might be tender in the abdomen. Next slide, please. And they would have some diarrhea. So the main thing, we have had this new alert since the 21st of, well, even before the WHO was looking for it, but as of the 21st of April, WHO has sent out an advisory telling us about the cases we have had so far. And as of yesterday, the update is 200 children in worldwide who have been diagnosed with hepatitis. Not the usual hepatitis A, B, C, D, or E. It's a new hepatitis. And we have had a few of them who have been ill, requiring liver transplants, and only one so far who has died. Majority, interestingly enough, has been in UK. We're not sure if there's something genetic or there's something else, but at least half of them have been in England. It's been in Europe a bit, and it's been in USA. It has not been in the Caribbean, and as of yesterday, there's been no cases of this mystery hepatitis at all in Trinidad. In terms of the information about it, it's usually found in children less than 5 years old and a few above 10 years old, but definitely majority less than 5 years old. And as I mentioned about the signs of, you're looking for jaundice, not the newborn jaundice. So do not think your 2-day-old child, that's bad jaundice. They expect for the newborn, you're going to have some mild jaundice and then it'll resolve by itself. I'm talking about after that newborn phase. If you're seeing those signs of jaundice, abdominal pain, loss of appetite, some diarrhea, and you're concerned, make sure you have them taken to a health facility and be a little bit absolute. Say here, what doctor or nurse, I want my child to have their liver function test done. And when they do give you the results, or they do get the results, ask them, what are the results? You should be looking for something called AST or ALT above 500. So in terms of the WHO case definition, they've been looking for all these liver enzyme values above 500. And what's the cause? Actually, the thing about the science of it is really much evolving. So at this present time, the absolute answer to that is they don't know, they're not sure. So most likely they're looking at adenovirus. So adenovirus is lots of, we have had coronaviruses, we have had rhinoviruses, metapneumo. It's all in the viral family, and it usually will cause flu or some gastroenteritis. For this one, they find it's the cause of the hepatitis. It's 41F, or in some people call it F41. But they've found the majority of them, but not all. And for some of them, they've found there's a connection with the previous COVID infection. They had a case in Singapore, the 10-month-old who had COVID in December, and a few cases in Indonesia. But the ones in Alabama and USA have not shown that prior COVID infection correlation. So again, I'm not sure. The theory is on. I think it might be a combination of factors. So we're looking at the fact that we have had a weakened immune system for the past 2 years with children at home. Usually those children who are 0 to 5 would have been in preschool and having that interaction. And once you don't have that, your immune system doesn't get strengthened. It's not exposed as much. And therefore, they found that it's a weaker immune system. They're thinking because this has happened now with Omicron, it didn't happen before. They're thinking that it might be that the Omicron itself is causing the liver, because of course we know all those receptors are there, liver to be a little bit more inflamed when you get exposed to the adenovirus. So it might be previous infection with COVID in addition to weakened immune system caused by the adenovirus. So we're watching this space, looking at the numbers and seeing what happens. But you yourself have to be aware, so you would not panic because of course you're prepared, but you'll know to look out for jaundice in your child. So we're not sure yet, but as soon as more information comes out, I will give you as much as possible. Next slide, please. So, yep, next slide. All right. So in terms of the actual new hepatitis, note that there's no link to the COVID vaccine at all. Those children less than 5 have not had the vaccine. There's been no link to that. There's been no link so far to return to school. We've had children last year return to school in Europe, and they found the only link so far may be the Omicron, so they're not sure about that. And so far, as I mentioned, no cases in Trinidad. So watching this with a really strong eye to make sure we're moving ahead and picking up things even before it goes further into the Caribbean, but we're not sure yet. Last slide. Next slide, please. So in summary, build your COVID kit. Get your stuff together. Go at home, build your kit, be prepared. Look out for the things we mentioned. We're looking at the signs so far. We're looking at more of chickenpox, hand, foot, and mouth viruses, fever. We're looking at you being confident, knowing that the fever beyond 4 to 5 days is significant. Less than that, you can handle it. Looking for febrile convulsions in your child. And last slide. Next slide, please. The main message, though, I want to give to parents: learn what to do so kids know what to do. You have the confidence. You know your child. You're going to be monitoring your child now. When the child is going to school, when they go to play, they come back, check your child, monitor, be calm, have your connection with your medical person, either nurse or doctor, but have the confidence to know what to do because you learned what to do. Thank you very much for your time, ladies and gentlemen.
And thank you very much, Dr. Paul. I think there are a couple of things I need to add to my COVID kit, but we really appreciate you sharing the information with us today. We close off this morning's presentations with the Honorable Terence Dial Singh, who will provide the latest vaccination figures and update us on the current initiatives regarding the national COVID-19 vaccination campaign.
Thank
Minister.
you. Thank you very much, Al. Good morning to Dr. Richards and Dr. Paul. Dr. Paul, thank you very much for updating us on what is happening with our children, and especially the fact that we have no cases of that hepatitis concern in Trinidad and Tobago. And just to reiterate, it is not linked to vaccinations because we know certain people will latch on to that. The vaccination numbers continue to be very low. They are now at a snail's pace. Yesterday, we vaccinated roughly 291 persons only, which is a combination of first dose, second dose, and boosters. Number of persons with first dose, 690,784, which is 49.3% of the population. We are still stuck at 50.8% fully vaxxed, 711,437. And what is concerning, because we had a chat with Dr. Trotman this morning, and this is a particular concern to us now, that the number of boosters is very, very low, and I will explain why that is of a concern. 151,124 people have been boosted. In talking to Dr. Trotman this morning, what she is noticing, and which we have spoken about, is that, and Dr. Richard shared it, is that 82% of our patients in hospital are unvaccinated. So, ladies and gentlemen, we ask you to act in your best interest, your family's best interest, and get vaccinated. The vast majority of the deaths, in speaking to Dr. Trotman this morning, over 90%, even though small numbers, but you see it starting to inch up to 5, are mainly the unvaccinated and the unboosted. So we are also seeing a couple dialysis patients who are either not vaccinated or not boosted, unfortunately passing away. So the message this morning is for those who are at particular risk, especially the elderly, those with comorbidities. What is a comorbidity? Any condition that you are living with that affects your immune system negatively, like diabetes, hypertension, obesity, certain cancers, autoimmune diseases like lupus, etc., even arthritis. If you're a dialysis patient, regardless of age, we ask these people, if you are not vaccinated, to start the vaccination process. And if you are not boosted, to get boosted, because your level of immunity is going to start to wane and you are going to be susceptible to COVID. And why are we insisting on vaccinations and telling persons that you can be susceptible to COVID still, even as we enter into the 3rd year of this pandemic? I distinctly remember on the 24th of October 2020, I think the Honorable Prime Minister was having his first press conference in Tobago to deal with COVID, and I was there. And at that time, we were given the nation a sort of global picture of what was happening with COVID. And at that point in time, there were 7 countries in the world, I remember distinctly because I have my notes, that clocked 1 million cases or more of COVID-19. That was October 24th, 2020. 18 months later, at the end of April, that has moved from 7 countries with over 1 million to 61 countries around the world with over 1 million cases of COVID. So the COVID pandemic is not ending. It may be waning, but it is not ending. The current global count of COVID cases is 514,763,538. 514 million cases, and unfortunately 6,266,199 persons have succumbed, and we have contributed to that figure. So we are asking people to recognize that COVID-19, even as we hope it transitions from a pandemic to an endemic stage, is still with us. It is a threat to your life. It is a threat to the livelihoods of families. As we respond to the needs of the population, especially for mental health services, you may recall that we started the Find Care TT initiative in May of 2020, I believe. But we had a serious push in recent times. I just want to give the population and media practitioners some idea of the numbers of persons visiting our websites and what are the top 4 visited sites. So the total number of users of Find Care TT is 34,055. New users, 34,464. So we are happy for that. Total number of page views, 64,045. And we do a disaggregation between men and women. Female, 57% of those views and so on are for female users and 43% for male. In addition to FindCare TT, the Ministry of Social Development and Family Services also has, under their ambit, and they have published it in the newspaper, it's on social media, it's on their website, they also have their own hotline. So there's a plethora, a menu of avenues for people to get help 24 hours a day, 7 days a week. Because as the pandemic progresses, the sequelae of this is going to be mental health issues. The top 4 visited pages, and we need to tell the population this. So the population, especially those individuals or families who recognize they need help, they are 1, suicide prevention, the top page visited. 2, gender-based violence. 3, matters pertaining to addiction. And 4, general helplines. Since we had the latest push when we launched it or relaunched it in San Fernando Hospital maybe about a month ago, we have had about 15,000 new users. So we are going to continue to push. We want to let people know and families know, co-workers, you are important in all of this. If you suspect somebody may be a little bit mentally disoriented, challenged, speaking in ways that they don't normally speak about, help is there. Reach out to us via these helplines, the websites, and help is there. I want to now bring you up to date on where we are with the acquisition of the Pfizer vaccines for the 5 to 11. We anticipate something very soon. I don't have firm dates as yet, but the logistics to bring it in, getting flight details and so on, are being worked on. And as soon as we have a confirmed date, flight number and so on, we will come to you. The next piece of information I would like to share with the general public, in speaking to my colleague, the Minister of Education this morning, is to give the cases, because I got the data from my colleague, for the week 25th to 29th of April, out of 243 schools reporting, between staff and students, there are 288 positive cases. And those tests and other tests done, 23 were negative. So those are the cases in the school system, 288 positive. That's between both teachers and students, right, of 243 schools reporting. So as soon as we get more information again from the Ministry of Education, we will bring it to you. So all those are my 3 main messages this morning about mental health, update on the Pfizer vaccines for the 5 to 11, and sharing the data that we have for you from the Ministry of Education. So I think we are ready for questions. Thank you very much.
And thank you very much, Minister. Of course, up next is our media question and answer segment. We ask the media representatives to state your name and the name of your media house before posing your questions. We are requesting, as usual, a maximum of 2 questions per media house in the first instance, and once we have additional time, we will field additional questions. We will take our first question from the Express. Express, good morning.
Good morning, Kim Woodram from the Express. Sorry. My first question would be primarily for the minister, but of course the doctor's opinions are also welcome. And that would be any concerns, Minister, about COVID in schools and perhaps the ministry's involvement. We have spoken about this, but to update the ministry's involvement in it. Also, can we address booster shots again? We're still getting a lot of questions about a 4th shot possibly, as well as flu shots, given the upcoming rainy season. Thank you.
Thank you. So let's take your questions one by one. We are concerned about COVID in any environment, including schools. We are concerned about COVID in the workplace, in the home, in our hospitals, and in schools. So yes, we are concerned about it. But at this stage of the pandemic, the option of shutting down and keeping people away from work or away from school is not one that is recommended, because the long-term socio-economic effects are going to be felt for years to come. On the issue of the fourth shot, thank you for raising it again. WHO has not signed off on a fourth shot as yet. And on the flu being linked to rainy season, the flu shot is not linked to our rainy season. The flu season in Trinidad and Tobago runs from October, November of any year to May of the following year. It coincides with the flu season in the northern hemisphere because of the cold weather in autumn and winter. That's how our flu season in Trinidad and Tobago runs. So we started vaccinating people with flu vaccines in October last year when we got them in, and that will come to an end by the end of May, because the flu season runs from October or November of any year to May of the following year. At North Central RHA and the other RHAs, I was there up to Saturday. We had a men's wellness clinic. We were giving out flu shots. We were giving out every single vaccination known to man. And that goes on across the board at all health centers. So thank you very much, Kim, for your question.
Thank you very much, Minister. And with that, we go to Guardian Media for your question.
Hi, morning, everyone. Rashad Khan, Guardian Media Limited. Okay, Minister, so both my questions this morning are for you. The first one is to follow up on that figure you gave us on the amount of cases in schools. So I just want to clarify that those numbers are just cases that emerged between that 25th to 29th of April and does not account for any others. And if there's any breakdown that you can give, if you got that from the Ministry of Education, like by secondary schools and primary schools, that kind of thing. And my second question is, now that we seem to have the stealth Omicron variant being dominant in the population, we have less severe illness despite its infectivity. And so deaths isn't really something at this point in time that is, I don't want to say a main focus, because it's not something that we're seeing occurring so much right now as compared to previous waves. But what I was wondering is, at some point, even if this thing gets milder, we're going to probably have to focus not so much on the saving lives, but more preserving quality of life. And I'm speaking in context of the long COVID phenomena that we've been seeing. So I'm wondering, is there anything or any plans from the Ministry of Health to probably expand that long COVID clinic at the Arima Hospital? Thank you.
Thank you very much. So yeah, I don't have detailed breakdowns. I didn't get that from the Ministry of Education to primary schools or whatever. I just have the gross numbers. On the issue of Omicron deaths, I remember on Easter Sunday, when we had no deaths for that day, that I spoke to media houses. And I was very cautious to say this is not necessarily a cause for long-term celebration. One day of 0 deaths could be followed, and those were my exact words, could be followed tomorrow by deaths. What we did see from Easter Sunday to now was a pattern of 1 or 2, but then suddenly yesterday, I believe it was 5. Yes, suddenly yesterday was 5. Now, as a percentage increase, it's big, but from a small base. But we are deeply concerned about deaths due to COVID at this point in time. Why? Because over 90% of those deaths are in the unvaccinated. So we are deeply, deeply concerned, and that's why we keep telling people to be vaccinated. On the long COVID clinics, the long COVID clinics are not both, in North Central. Southwest started their own long COVID clinic, I believe, in November last year, Dr. Paul. Dr. Paul, yes. And there are plans to start one in Northwest, because we recognize, like the mental health challenges, long COVID is going to be another clinical sequelae that we have to deal with. So that's why we were very proactive with the mental health outreach, and I gave you the numbers. And we had Dr. Sanya Mohammed here just about 2 weeks ago speaking about all that we are doing for long COVID across the RHS system. So you are spot on, Prashad. Long COVID is going to be here to stay for the medium term, and we have to treat with it. Thank you very much, Rashad.
Thanks again for your question, Rashad. And with that, we go to TV6. Good morning.
Hi, good morning to the entire panel. Alicia Boucher from TV6 here. My first question is for the Minister. Minister, I know that we were in talks with Pfizer to acquire, I believe it was Paxlovid. Can we get an update on that? And the second question, I don't know who would want to take this, but with the cases rising and that slow increase in hospital occupancy that we are seeing against the level of that opening up that we've done, which is quite a wide opening up, would you say that case management is important before people get really ill? And if so, how can we do that both on the medical front and on the home level as well, in terms of are there any drugs, medication, and so on that people can actually take before becoming very, very ill and, ending up in a position where we have a high level of hospital occupancy again? Thank you.
Thank you very much, Alicia. Yes, so let me deal with the Paxlovid question, and then all three of us will deal with the issue of medication and so on. So yes, we are pursuing the acquisition of Paxlovid, as I have said, but we have also signed a non-disclosure agreement with Pfizer, so that prevents me from talking too much in the public domain until things are signed, sealed, and delivered. Dr. Joan Paul has always been very forthright talking about the COVID home kit, and she spoke about it this morning. Your antipyretics or fever reducers like paracetamol. Never use aspirin, and I think I want Dr. Joan Paul to explain why you never use aspirin to reduce fever in children. The preferred one is paracetamol. Then you have the ibuprofens. She spoke about rehydration, diluted coconut water, but we're not supposed to call brands, eh? The diluted energy drinks. Keep your children hydrated, even plain water, whatever. And so I will turn you over now to Dr. Joan Paul and maybe Dr. Richards, who could talk about how we could prevent hospitalizations. But as Dr. Richards has been saying ad nauseum, come in to a hospital facility if you are unsure at the earliest stage to prevent the disease progressing to a crisis. Dr. Paul?
Thank you, Honorable Minister. I think the main thing is to know yourself. So if we know, for instance, that obesity, diabetes, hypertension, and also if you're pregnant and those things are, or those states are very high risk, or you're very vulnerable. So if by chance you're in that state and you recognize that you're COVID positive, I would say be really careful to monitor yourself on a daily basis. So we're looking at, usually there's a checklist. I would say you're at home, you have Omicron, you have those key things. Check your heart rate every morning, your oxygen level, check your fluid, make sure you're having lots of fluid. What Omicron does, you have like what we call third space, and so the fluid is shifted into different areas, so you get more dehydrated than you should be. So you have to optimize your fluid. So more fluid. Make sure you have your comorbidities under control as much as possible. So having your diabetes, hypertension well controlled is a big feature of making yourself protected. So I would say look for those who are vulnerable, optimize yourself, monitor carefully heart rate, respiratory rate, your oxygen saturation level, how you're feeling in terms of lethargy, etc. And if you find you're getting much worse very fast, as Dr. Abdul Richards has said, go to a hospital setting to say, I am vulnerable, and make sure I am COVID and vulnerable. Check me, please. If, for instance, you're not vulnerable, there are a few things you can use, as the minister mentioned: vitamin C, vitamin D, your Advil, your ibuprofen or your paracetamol. Make sure, what we find often is that even with the adults, they get a little bit wheezy. So COVID and Omicron does cause you to wheeze. If you wheeze before, So if you find that's a wet, chesty cough, make sure you have your salbutamol inhaler and your spacer there. Get some sunshine, not too much activity. What I found is that if you're lying all the time, it makes you at risk for having some clots. So therefore, you have some activity. But you don't want to be running a marathon or going for a hike. So have light activity. So fluids, light activity, vitamin D, vitamin C, your paracetamol, ibuprofen. For children, though, not aspirin. But if you're an adult who has comorbidities and you've been on low dose aspirin, continue with that just to prevent the clots. And as I said, the main thing is monitoring, checking with your healthcare provider and checking yourself. Dr. Richards, anything else?
Before we go to Dr. Richards, I know you said it, but could you explain to the population via Alicia, who asks a very good question, why we don't recommend aspirin for children with fever?
Sure. So with aspirin, sometimes you get something called Ray's syndrome, which is where the liver, the same liver we spoke about, gets a bit inflamed, and you also have a few other organs being affected. So it's something that is what we call contraindicated. So we do not use pure aspirin in children. They have found a few cases with that, unless, of course, you're in hospital and there are a few things that your doctor will recommend aspirin for. But for the average child, your child, we do not use aspirin. It has some effects and complications associated with it. Okay? Thank you.
Thank you, Dr. Paul and Minister. I'd just like to remind the population to be aware of the symptoms and signs of COVID-19 and be aware of the increased risk and transmissibility of the COVID-19 virus due to the fact that we have the Omicron variant circulating, and also because we are moving around a lot more with schools reopening as we return to normalcy. So please, if you do observe someone in your home or in your workplace or a friend with symptoms that are suspicious, a runny nose, a sniffy nose, consider it to be COVID-19 first. Don't think it's a common cold and it may be COVID-19. Consider it to be COVID-19. Have yourself tested. Ensure that you look out for the symptoms. Dr. Paul would have given the at-home advice, and if you are deteriorating or decompensating, or if you have any comorbidities, or you're in that group of persons who cannot be vaccinated, please seek urgent medical attention. Early recognition of symptoms, early medical attention, and the use of Ministry of Health approved treatment protocols and guidelines has been demonstrated to save lives. So thank you very much, Minister and Dr. Paul, for this discussion.
Thank you very much, Minister. And with that, we go to azpnews.com.
Hi, good morning, Suan Wayo. Hi, good morning, Suan Wayo from azpnews.com. Just asking for some stats. Dr. Paul, would you have any information of the total missing cases of those who may have died, if any, and the ages? And can anyone confirm the number of total COVID-19 cases and deaths for the month of April, please? Thank you.
All right, thanks for that question. Just to confirm again, we have had no deaths, 0 deaths from Missy in Trinidad and Tobago since we started with the pandemic. As I mentioned before, I think the ministry has been really connecting with all the specialists. So the heart specialist for children, Dr. Ronan Ramrup, he has been aggressively on the case. So any Missy case that comes forth, he gets involved right away. He'll come out on a weekend to do that heart scan. So I think because all the pediatricians and him, we have been extra aggressive with this. We have had 0 cases. And even the other specialists, which were at liaise with this morning, Dr. Sherman Soman, who is the gastrointestinal specialist, we also will be liaising with him with regards to any signs of anything with regards to hepatitis. So we've been linking in with all our specialists who are aware and have been really informed and aggressive with anything looking forward. So 0 Missy deaths at all since we started the pandemic up to now. Thank you.
Thank you. And Suan, for your second question, we don't have that disaggregated figure for April easily available. but it's something we can get, and hopefully Dr. Hines, who normally does that, we can get the epi information out. Thank you very much, Swan.
Thank you very much. We go to follow-up questions, and we start with Guardian Media Limited.
All right, thanks, Al. My question here now is for Dr. Abdul Richards. Now, Dr. Richards, I remember once upon a time ago, last year sometime when we were anticipating the spike, that we did have a hospitalization rate that we were working with to kind of help us predict how many people, depending on how many cases, would need hospitalization. But now understanding that now it's a different variant and we have we don't have as much of an immunonaive population, do we have any sort of rate like that that we could use?
Thank you for your question, Richard. So yes, you've highlighted an important point in that the hospitalization rate would vary from one wave to the other and is dependent on the actual variant that is circulating and how severely ill persons are. So in the last wave, when we would have seen the increased number of cases with the Delta variant, we were at a hospitalization rate of anywhere between 18 and 23%. Now, with this current wave, what we've been noticing from on or about February to present, the hospitalization rate is between 3 and 7%. So it is indicating that statistic, which is an indicator, does demonstrate that the Omicron variant appears to be less clinically severe, and it also demonstrates the impact of vaccination in our population. So thank you.
Thank you very much, Dr. Richards. With that we go to no more. Okay. All right, so I think we're out of time. All right. So in closing, we ask you to please continue to protect yourself and your loved ones. Remember, COVID-19 vaccines are approved by the World Health Organization and are safe, effective, free, available, and accessible. No appointments necessary. These vaccines are available in all 5 regional health authorities and at all 109 public health centers, in addition to advertised vaccination sites. And yes, we do have vaccinations on Saturdays. If you have not received your vaccination, COVID-19 as yet, or are due for a booster, please get yours now. Don't delay. Vaccinate today. And remember to practice the 3 W's. Continue to follow the Ministry of Health on the social media and for accurate and up-to-date information. Stay safe and goodbye for now.
The Mother Church of the Anglican Diocese suffered significant damage during the earthquake of 2018.